Hi, Dr. Sasse here from the Continence Center at Sasse Surgical in Reno, Nevada. So I had some questions recently from people who've had sacral neuromodulation and actually were having great success with the Medtronic InterStim device, but the battery ran out or something is wrong with it, it's not working anymore, and they're now battling with the severe problem of urinary incontinence or bladder leakage or bowel leakage or both in some cases. And they just were puzzled about and wanted to work through what the best path forward would be. So let me just try to clarify how we usually approach that. And usually we get great results for people, and usually they're able to totally solve the bowel and bladder leakage with the steps that I'm going to describe. So in a nutshell, the prior devices, the InterStim device, had a battery life that varied a little bit based on the settings, based on the power that was required in order to achieve enough gentle current down to the pelvic floor to give good results. For some people, that had to be turned up higher in order to really get good stimulation of the muscles of the sphincters and pelvic floor. For other people, lower current. So if you had less current, just think of, any other electric device in your house. If you're using more juice, more power, and it's battery operated, you're going to run down the battery faster. Well, many people 2, 3, 4, 5 years later found that the battery ran out completely, and then all of a sudden they're battling with the same old symptoms that they were experiencing before. The good news is that when I asked people about what it was like in the first year or two after the InterStim device was placed, most people say it was pretty great. It was actually helping a lot. They were having way fewer accidents, much less leakage. They may not have had to wear a pad. They were able to sleep through the night. They weren't having to, carry around spare underwear and all this kind of crazy stuff that people learn to live with because the InterStim device was doing its job. But once it is no longer working, then they're left with the problems all over again. And so what we've found is that we're able to get an excellent solution for them by changing out the old device and putting in a new device. Now in our hands, we currently are enamored with the Axonics device. This is the kind of newer upstart company that has improved a bunch of features. I'm not here to push any particular company. I'm just saying over the years, companies innovate, and right now, we think the iPhone is better than the Samsung or vice versa, and right now there's a device that has sort of a bunch of awesome features. And as time goes by, these two will continue to innovate, and one will be better than the other. But be that as it may, they're both excellent at restoring bowel and bladder control. And so it's pretty easy to take out the old device, and that may cause a bit of soreness where it lived and where the old lead was in the sacral foramen, but not too bad. It's still an outpatient procedure with some local anesthetic. Usually does not take very long. It's usually, 20, 30 minutes to do this whole procedure. And while we're right there at the same moment, we can normally find a new location and place a new quadrupolar lead, meaning the lead that has 4 different contact points, and get that dialed in just perfect. We have our computer right there. We can test the engagement of the sphincters and the muscles and show that we're getting excellent restoration of the bowel and bladder control right there. And then we can implant the new device, which by the way is a lot smaller, and so it goes in a little tiny pocket that is real easy to slip under the skin. Most people don't even feel it after it's in. And that can all be done generally right then at the same moment. Now sometimes the insurance plans need a little convincing, but generally speaking that is all approved as long as a person meets the normal criteria, and they can, tell you that they do have this problem and we can document it. There's usually not a lot of pushback from the insurance plans today. And believe me, they push back on all kinds of things across every specialty today. So it just kind of speaks to the fact that this sacral neuromodulation technology works very well, and it's very well proven. The fact that the insurance plans acknowledge that, and it's covered very liberally and very widely from Medicare on down to all the employer-based plans. So if you find yourself in that boat, please don't lose hope. Don't think that there's nothing that can be done. The best case scenario, if you see someone like us at the Continence Center or wherever you are locally, is talk to them about changing out the old device and putting in the newest kind of current version of the device. It's like putting in the whatever we are at now, the iPhone 12 or something like that for the one that you had before. That can generally be done as a 30-minute outpatient procedure with some local anesthetic, and usually you're off and running with an excellent, long-lasting, and very effective device to restore that gentle current down to the muscles, stop the incontinence, stop the bladder and bowel leakage. And here's the best part. The new device has a battery life that is 15 to 20 years or longer. So that's kind of amazing. You won't have to have surgery to replace it or take anything out during a huge long stretch of time. All right, I hope that's been helpful. If you find that your old InterStim device isn't working, please go seek an expert to help, because the odds are it will be super helpful for you. I hope this has been helpful for you, and I wish you the best of health.